Hi everyone, sorry about that. I just did the Facebook Live and found out that my microphone battery went dead. So I'm going to repeat it. Hi, I'm Dr. Sally Foote, a veterinarian with over 35 years of general practice and veterinary behavior experience. And I am here today to teach you about or help you understand this feline ladder of aggression and how we can use this to make sure we don't go over the threshold, we don't push our cats over where they're resisting care. This is really important, of course, in the veterinary clinic or shelter setting, because we want them to like coming to us when they're sick, but also at home, for our cat owners at home. So this handout here, I'm going to bring it a little further forward, I have on my website, drsallyjfoote.com. You can go under the veterinary professionals tab, under the resources, and there's a button that says the feline ladder of aggression. Just click the button and you can download the PDF there. You can also go to the pet owners page and you will see the same button and you can download it there and print it off. So this ladder of aggression is showing how cats show the early signs of being anxious. Things like just laying on their sternum, on their chest with their kind of legs tucked under, dilated pupils, sitting still or grooming a spot, and we're about getting about a third of the way up the chart there, so where it goes to the point of hiding. Then how the cats will shift over to being aggressive, where the cat starts to stare, swat, bite, or we get multiple bites. Now, of course, when we're handling our patients, I'm going to move the camera just a little bit here, Banks, so we can see a bit better. When we're caring for our patients, our cats, we want to be sure that we are not continually touching them, continually handling them, driving them up this ladder. Now, a few tips on this ladder. Each step is 0.1 second. So let's say I go ahead and I start holding around Binks's face to examine in his mouth. And he started up with just, kind of a little bit of dilated pupil as I touched his face, but then he got up to where he was hunching his head down and hunching his body down, and then his ears turned back. I am now entering into the aggressive part, and if I keep holding his head and I keep doing the mouth exam, I'm going to push him up to where he's going to bite me. So I need to pay attention to how he's responding with his body and think, what just happened? Can I get it away from Binks or get Binks away from it? And in that case, maybe I need to do a mouth exam, but I need to think of ways then to decrease how I'm holding onto the head, because holding onto the head is what increased his agitation and increased those signs going up the ladder of aggression. So 0.1 second up, about 2 to 3 times longer coming down. So I stop touching the head. He's going to calm down within a matter of 3 to 5 seconds if I stop it early. So that's what's so important about having this ladder of aggression taped to the wall at home, wherever you treat your cats. Remember I talked about the kitty care center, or at the clinic around any treatment area, exam area, in the wards, so we can pay attention to our cats. So I'm going to get my little friend back, and I'll be right back. Thank you. Okay, so a few tips I want to give you about reading cat body language. We all talk about like whiskers pulled forward. So in a cat's skull, as you can see in Binks here, his skull is kind of wedge-shaped. And when the facial muscles are relaxed, and that's when a cat is relaxed, the whiskers will lay alongside the cheek. But when his lips start to tense up and his face starts to tense up, the whiskers are going to pull sideways this way. They're going to pull forward like this, and you'll see that air gap or that air space between the whisker and the side of his cheek, and that's how you see the whiskers. So that's a clue when you think to yourself, oh, those whiskers are really big. That means he has facial tension. Of course, the dilated pupils, even if that little slit starts to widen up, that's just a quick way to tell, like, okay, you're getting a little bit tense right here. What can I do to decrease what just triggered you up? Now, managing this, let's just talk about a few common exams or treatments at home that tend to be very stimulating or possibly stressful for the cat, and that is handling the head. If we need to give medication in the eye, medication in the ear, do a mouth exam, an eye exam, or an ear exam. So let's start here with the mouth exam. So if I were to take a hold of Binks's face all like this, I know it's hard to see his ears because he's, I'm holding him in my hand, but he's kind of starting to hunker his body down. That's his way of saying, your hand all over my head, I don't like. I'm not going to keep doing that to you, buddy. So instead, I'm going to think of taking the side of my hand here or here along my index finger and just use it only along the edge of his jaw to hold the head up. And I want to eliminate hands on his head because his resistance came from hands on his head. So how can I get my job done without having hands on his head? Oh, on his head, or minimize that. Okay, instead of a whole hand, can I go to like one finger? Yes. Can I take a Q-tip and use this to elevate his lips and look into his mouth? Yes, I can. Or if I needed to swab his mouth, or I wanted to brush his teeth like an owner at home, this is how we could hold his head, put a little bit of something good tasting, like a toothpaste, rub his lips, and then I give him a break. The action of actually rubbing in his mouth only lasted 2 or 3 seconds, and I'm going to stop for like another 2 or 3 seconds. So this is how, rubbing in his mouth, doing the mouth exam took him up a little bit, where he started to kind of pull back. But then I stopped, and then he went, okay, and he calmed down. So you kind of are going up and you're going down, and you're going up and you're going down. This is what I call the dancing around threshold. And that's how you're managing the stress to prevent just driving straight up. If I kept, if I took my hand and I took my finger and I'm all like this in his mouth, you can see he already started pulling back. And if I kept pursuing this over the next 10 or 15 seconds to really get a good look at, say, an upper fourth premolar that might be infected, then I am going to shoot him up to biting, and not only might I get injured, but then he remembers, oh, mouth handling's horrible, and then he's so escalated up, it takes a cat at least 2 to 3 times longer as compared to a dog to calm down. It's going to take a lot longer to calm down. So I would need to think, okay, whoa, stop. Don't have so many hands around his head, or he may be painful. In which case, I need to give that pain medication now before I pursue farther in the exam. So doctors, be much more preemptive with pain relief, and clients, please don't fight with your cats. If they're really resisting this, be sure to call, text, email the veterinary practice and say, I'm really having trouble doing this treatment because he resists it. Because that might be the only way that he's telling you either he's painful, we need more pain management, or lastly, to really have a good examination, we may need to give him a sedative to do this in a complete and thorough way for him to not experience the pain or problems with it. Well, you can see what is he doing right now. He's climbing up in my arms because you said, we already did this once, and now we got to do it again. As he wants to get down and explore, but he's also kind of like, okay, you're going to keep doing this to me, Dr. Foote. And I'm not. I'm going to give him a break right now. I'm giving him some more temptation treats to help him calm down, and you see that he is. Now, a couple other points too is, of course, we do not want to scruff our cats, and finding these alternative ways to handle them is important. Using just one hand or two hand for lifting the head. You can use the pillowcase as a way of avoiding scruffing the cat. And the way to do that is now I'm going to show you on Banks because I want to show you. And secondly, I also want to show you, if he doesn't like it, how I'm not going to pursue using this tool. So hang on, buddy. I know it's been a little bit of a long afternoon here. Take a bunch of treats while I roll this. So you can take something like a pillowcase and roll it up. There you go. So it's like a cloth. Yes. And we're going to take this and quickly go around his head, and then we can hold the pillowcase, there you go, like so, instead of scruffing him. And as you can see, I still have the same anchor point for control on his head, and he's actually interested in eating, which is good, which means he likes then having this cowl on his head, but I have control over him. And I can use my forearm along his back to prevent him from rolling. And now if I want to, say, swab in his mouth, give him some liquid medication from the side of the mouth, look in his mouth, I can take the Q-tip and just lift your lips, sweetie. Yes, and open up your mouth like a little bite stick. Very good. And now we're done. He has had 0 hands on his body. And he's not resisting it because it avoids the most common trigger for cats, yes, which is hands on their body for care. And frankly, a big part of that stress about hands on their body is frankly coming from the scruffing and the holding them down and us pursuing, because we're missing how the cats are showing us they're driving up this ladder of aggression, which is why I published it. So please download that ladder of aggression, post this up at home, give it to your clients so they can put it in their little kitty care center, have it in the exam room, the treatment room, surgery prep area, and kennel areas, so that way we all can be aware of how the cats are showing us what they don't like, and we respond to it. We get the stimulus away from them, or the cat away from it, and minimize that triggering. Thank you very much. You can find me at Foote and Friends, my website, also here at Facebook, and also on LinkedIn. I have a YouTube channel with over 170 videos demonstrating handling techniques in my Facebook Lives that I've been doing for the last 2 years. And last but not least, I am offering live seminars this year here at the Bella Behavior Learning Center in Tuscola. I also can take those out on the road to shelters and veterinary clinics for staff training to help get everybody on the same page with this low stress handling for dogs and cats, especially in the aggressive, anxious, or painful sick animal. Thank you very much, especially thank you for helping to use low stress veterinary care, low stress care for all of our patients, and have a great day. See you next time.